Here's a physician and researcher from California called Dr. Dan Erickson. Erickson and a partner just delivered a 50-minute briefing on the latest numbers from California. The video they made has been viewed millions of times in a few days online. The bottom line is, after looking carefully at the data, these two researchers have concluded that California should end its shelter-in-place order. Watch.
We've seen 1,227 deaths in the state of California with a possible incidence or prevalence of 4.7 million. That means you have a 0.03 chance of dying from COVID-19 in the state of California. 0.03 chance of dying from COVID in the state of California. Does that necessitate sheltering in place? Does that necessitate shutting down medical systems? Does that necessitate people being out of work?
These are serious people who've done this for a living for decades. They have in their hands the largest currently available data sets on this question. And the question they're asking after analyzing all of those numbers, are the lockdowns worth it? So what is the answer to that? What's so striking is that so many politicians, the ones enforcing the lockdowns, don't seem at all interested in asking it. Instead, they're bullying forward as if nothing has changed. Just today, the San Francisco Bay Area announced it'll be extending its lockdown until the end of May. That's 5 weeks from now. What is the scientific justification for doing that? They didn't tell us because there is none. None. You may remember what they first told us back in February and March. They said, we have to take radical steps in order to, quote, flatten the curve. Well, 6 weeks later, we're happy to say that curve has been flattened, but it's likely not because of the lockdowns. The virus just isn't nearly as deadly as we thought it was. All of us, including on this show, everybody thought it was. But it turned out not to be. Hospitals never collapsed. Outside of a tiny number of places, they never came close to collapsing, at least not from an influx of infected patients. Instead, something remarkable happened, something amazing, really without parallel in American history. The opposite happened. Thanks to the lockdowns, hospitals have begun to collapse. Why? From a lack of patients. Politicians who couldn't pass ninth grade biology decided that practicing physicians should not be allowed to calculate the risk of transmitting the virus. They're just not qualified, unlike us. So these politicians banned so-called non-essential procedures, many of which are in fact essential. The result of this policy? In many hospitals, entire floors have been mothballed. Doctors and nurses are being furloughed in the middle of a pandemic. This is insanity. It weakens our healthcare system